We're back on To Your Health. I'm your host, Dr. Bruce Bonanno. Oral cancer is difficult to detect by the naked eye, but that doesn't mean it's not a major threat to your health. Joining me on the show once again is Dr. Pete Ciampi, a general and cosmetic dentist from Spring Lake Smiles. You guessed it, beautiful Spring Lake is where it's located. Pete, welcome back to Your Health.
Pleasure to be here, Bruce.
Now, oral cancer. Most people don't think about it. It's just like they go to the dentist. And I know when I started going to the dentist years ago, I didn't do this, but now my dentist, the hygienist, they're feeling all around. And I guess that's what he's checking for, oral cancer.
Absolutely. It's so important that you make sure your dentist is screening for oral cancer. Oral cancer is so invasive that when caught early has an excellent survival rate, but left untreated can progress. The 5-year mortality rate has remained unchanged over the past 50 years. 30,000 new cases a year annually, and 8,000 deaths attributed to oral cancer.
So that's about 1 an hour.
That's correct, 1 an hour. If caught early on, cancer rates, 5-year survival rate is 80 to 90%. When caught in its later stages, stage 3 and 4, where it's progressing beyond the local site, less than 10%. The sad results is that 70% of these lesions are found in stage 3 and 4. So early detection can improve the survival rates of these.
Well, I guess you brought some pictures and we can throw those up, and
yes.
Why don't you tell us what's going on. I guess they're going to be up there. And
yeah, these pictures are all basically showing how innocent these cancers could look like. Mm-hmm. And it's so important that even innocent lesions are followed up and looked at very closely.
Mm-hmm. Okay, so detection. We said one of the ways I've noticed is that the dentist will check,
right,
and that's a good starting area.
Correct. It's so important that the dentist does the main visual and palpate of the oral cavity. They pull your tongue out, they look to the right and to the left, they have you say ah, look to the back of the throat, they'll palpate regional lymph nodes, submandibular lymph nodes. That's key, conventional screening, but we also have an additional adjunctive screening technology such as a product called the Visalite, which is important to incorporate, we feel in our practice, to help pick up these lesions at its early phases.
So just like what I do in my exam, the first thing is visual, you look,
right,
and then the next is palpation, you're
correct,
trying to feel something that you might not be able to see.
Exactly.
Now, then these other techniques are for things you don't, I guess, aren't obvious?
Right, they're less. Some of these lesions are very innocent looking. A white lesion that may look very, very simple in terms of maybe think it's traumatic in nature, which may be the case.
When you say traumatic, what's traumatic?
Well, if you bite your lip, or if you're eating a hard piece of bread and traumatize or irritate your palate or your cheek or your lip, these generally resolve in 7 to 14 days. The important thing is to follow these up, because if there is no history of trauma, there's a possibility that these lesions could be the beginnings of oral cancer. So what we'll do is, if we see something that looks innocent, we'll have the patient back in 7 to 14 days to follow it up. If it's still there, we can use something like this Visalite screening, which will be able to, it's an inexpensive, simple, painless procedure where the patient will swish with a 1% acetic acid solution and be able to identify if the lesion is still there in terms of the extent of the lesion. If it's still there, there's other techniques you can do. You can do a brush biopsy, which is another painless, non-invasive, simple procedure. If something looks pretty involved.
Well, when you say brush biopsy, most people think of biopsy, they know that's taking a sample, a tissue sample.
Right.
What's a brush biopsy?
Well,
what's the difference?
A conventional biopsy or an excisional biopsy, where the surgeon goes in there with the scalpel and cuts out a piece and is sent out to a laboratory for histologic evaluation. When we see lesions that are very suspicious looking, or they look nasty, we'll refer immediately to a surgeon for an excisional biopsy. In these innocent lesions, these lesions that you see these photographs of, a brush biopsy is just a little brush that you scrape the superficial epithelium or skin.
So just like the little tissue, almost like the DNA swabs we see people take.
Exactly. You brush it, it's placed on a little histological slide, it's placed in a container, sent off to laboratory, and they'll do an analysis of the lesion. If it shows as a suspicious further investigation, then we will recommend an excisional biopsy. So
okay, so I guess the next step is once somebody's been diagnosed, which is the most important step. the next is treatment. I guess it depends on what stage and how bad it is.
Right. You know, if it's a if the lesion is detected as being there's different levels of dysplasia. There's mild, moderate, and severe dysplasia. You can have carcinoma in situ or frank carcinoma. These lesions will need to be treated aggressively, and we refer to a head and neck surgeon or ear, nose, and throat surgeon, which generally will get involved an oncologist, and there's generally a head and neck resection involved depending on the extent of the lesion. It's so critical that these lesions are picked up early, because at the latter stages, you're talking about an involved procedure to remove parts of the tongue, the jaw, the regional neck area. It affects your speech, your appearance. So again, key is early screening, early diagnosis, picking it up at its earlier stages so that it improves the 5-year survival rates, and that's key.
And another thing going along with, I guess, the early detection is this is one of the few cancers that can spread somewhere else and become a primary, not just a secondary site. So it can spread somewhere in the body and produce cancer there.
Absolutely. It can spread to distant areas, and even though the primary lesion may occur in the oral cavity, it can metastasize, and that's where the prognosis really decreases from there.
We've got about a minute left. Real quick, who's at risk? Is there anybody specific?
Yes. Well, males over the age of 60, history of smoking, heavy alcohol use. The alarming trend is females under the age of 40. That's where you're seeing people with no risk factors getting this disease, and that's where we feel it's important that you get an annual examination. Make sure your dentist is doing the cancer screening. If you're not sure he is, ask him or he or she that they're doing that.
And another big risk factor, real quick: smokeless tobacco.
Smokeless tobacco.
Chewing tobacco, in other words. Don't do it.
Don't do it.
All right,
Absolutely.
Pete, thanks very much for that information.
Thanks, Bruce, for having me.
People will get checked, okay?
Absolutely.
Still to come on the show, we're talking about hyperhidrosis, excessive sweating. For those of you who don't know that big word. We'll talk about how it affects people's lives, and we'll also discuss some of the treatments available. That's straight ahead on To Your Health, only on News 12 New Jersey, as local news gets.